Have you ever wondered what role the small butterfly-shaped gland at the base of your neck plays in your body? This little powerhouse, known as the thyroid gland, may be small in size, but it plays a colossal role in our overall health. It's nestled right there, in the front of your neck, below your Adam's apple, like a shield protecting your body, and it's one of the most important glands in your body. Imagine an orchestra conductor setting the tempo for the music that the orchestra plays. The thyroid does something similar for your body, regulating everything from your heart rate to your body temperature. It's a fascinating organ, don't you think? But what happens when this conductor loses its rhythm? Or what if it starts setting a tempo that's too fast or too slow? Well, that's when things can get a bit complicated. In the next few minutes, we delve deeper into the world of the thyroid gland and its functions. The thyroid, often unnoticed, serves as one of your body's chief engineers. This butterfly-shaped gland, nestled snugly in the front of your neck, quietly orchestrates a symphony of bodily functions. Though small, weighing less than an ounce, its influence is immense, reaching far beyond its modest size. The thyroid is divided into two lobes, the right and the left, connected by a thin piece of tissue known as the isthmus. Each lobe functions independently, yet harmoniously, like two halves of a finely tuned instrument. Within these lobes, the thyroid houses thousands of tiny specialized structures called follicles. These follicles are the thyroid's production units, tirelessly manufacturing the hormones that regulate your body's metabolic activities. Now, you might be wondering, what exactly are these hormones? The primary hormones produced by the thyroid are thyroxine, often referred to as T4, and triiodothyronine, or T3 for short. Though their names may sound a bit technical, their roles are straightforward. T4 and T3 are the master regulators of your body's energy use, determining how fast or slow your organs work and how your body uses different nutrients. In addition to T4 and T3, the thyroid also produces calcitonin, a hormone that helps control the levels of calcium in your blood. This hormone plays a significant role in bone health, helping to maintain the delicate balance between bone building and bone breakdown. But the thyroid doesn't work alone. Its activities are closely monitored and regulated by the pituitary gland, which is located at the base of your brain. The pituitary produces thyroid-stimulating hormone, or TSH, which tells the thyroid how much T4 and T3 to produce based on the body's current needs. So, in essence, the thyroid is a small but mighty organ, a metabolic maestro, guiding your body's energy use and keeping your systems running smoothly. Understanding the role of these hormones brings us to the core functions of the thyroid. The thyroid, despite its small size, has a mighty responsibility. The thyroid, a butterfly-shaped gland located in the front of our neck, serves as the body's thermostat. It controls how our body uses food for energy, a process known as metabolism. When we consume food, our body breaks it down into glucose, a type of sugar. The thyroid then determines how fast or slow our cells use this glucose to produce energy. This is why, when someone has an overactive or underactive thyroid, they might experience unexpected weight gain or loss. But the thyroid's role doesn't stop there. It also plays a pivotal part in our growth and development, especially during infancy and childhood. The thyroid produces three hormones: triiodothyronine, T3, thyroxine, T4, and calcitonin. T3 and T4 hormones influence the growth of bones, the development of the brain and nervous system, and the maturation of other body organs. Calcitonin, on the other hand, works in tandem with the parathyroid hormone to regulate calcium levels in the body. It lowers blood calcium levels by slowing down the amount of calcium released from bones and increasing its excretion from the kidneys. This regulation of calcium is essential for the normal functioning of muscles and nerves and maintaining the strength and density of bones. In addition, the thyroid helps regulate body temperature, heart rate, and even helps control cholesterol levels. It's like the conductor of an orchestra, ensuring all parts of the body work in harmony. Indeed, the thyroid plays a crucial role in our body, but what happens when it doesn't function properly? Let's explore that in our next segment. Like any other part of our body, the thyroid is not immune to disorders. In fact, it's quite susceptible to a variety of conditions that can impact its function and consequently our overall health. Let's start with hyperthyroidism, a condition where the thyroid gland doesn't produce enough thyroid hormones. This can result in a sluggish metabolism. Some common symptoms include fatigue, weight gain, and feeling cold all the time. It's often caused by an autoimmune disease called Hashimoto's thyroiditis, where the body's immune system mistakenly attacks the thyroid gland. On the flip side of the coin, we have hyperthyroidism. This is when the thyroid gland is overactive, producing an excess of thyroid hormones. This can rev up your metabolism, leading to symptoms such as rapid heart rate, weight loss, and feeling hot often. Graves' disease, another autoimmune disorder, is a common cause of hyperthyroidism. Then we have goiter, which is an enlargement of the thyroid gland. This can occur due to a variety of reasons, including iodine deficiency and inflammation. Symptoms of a goiter can range from a visible swelling in the neck to difficulty swallowing or breathing. Now, it's important to note that these conditions are not exclusive. For example, you can have an overactive thyroid with a goiter, or an underactive thyroid without a goiter. The symptoms can also overlap, making diagnosis a bit tricky. So, what causes these disorders? Well, it's a mix of factors. Genetics certainly plays a role, as these conditions often run in families. Environmental factors such as exposure to certain chemicals or radiation can also contribute. And then there's lifestyle. Poor diet, lack of exercise, and stress can all negatively impact thyroid health. While these disorders may seem daunting, modern medicine has made significant strides in their treatment. From medication to surgery, there are a variety of options available to manage these conditions and help you lead a healthy, normal life. But remember, prevention is always better than cure. So take care of your thyroid, and it'll take care of you. Though thyroid disorders can disrupt daily life, they are often manageable with proper medical care. When it comes to treating thyroid disorders, the approach largely depends on the type and severity of the condition. Hypothyroidism, an underactive thyroid, is generally treated with synthetic thyroid hormone medication. This medication helps to restore the hormone balance in the body, improving symptoms and normalizing metabolism. Hyperthyroidism, an overactive thyroid, can be managed in a few ways. Antithyroid medication may be prescribed to reduce the production of thyroid hormones. In some cases, radioactive iodine therapy is used to shrink the thyroid gland. In severe cases, surgery might be an option to remove part or all of the thyroid gland. Thyroid nodules, if benign, may not require treatment but should be monitored for changes. If malignant, treatment might involve surgery, radioactive iodine, or thyroid hormone suppression therapy. Now, let's talk about prevention. While you cannot prevent thyroid disorders outright, there are steps you can take to reduce your risk. Ensuring you get enough iodine in your diet is critical, as iodine deficiency is a leading cause of thyroid problems globally. Seafood, dairy products, and iodized salt are good sources. Regular checkups are key. Thyroid disorders often show up in routine blood tests before symptoms become apparent. If you have a family history of thyroid disorders, alert your doctor, as this increases your risk. A healthy lifestyle is also beneficial. Regular exercise, a balanced diet, and stress management can all support thyroid health. Avoiding exposure to radiation, particularly in the neck area, can also help reduce the risk of thyroid disorders. Remember, early detection and treatment can make all the difference when it comes to managing thyroid disorders. So, don't hesitate to speak up if you're experiencing symptoms, and make sure to keep up with regular health checkups. Remember, understanding your body is the first step towards maintaining your health. To recap, the thyroid, small yet powerful, plays a significant role in our body. Nestled in the neck, this butterfly-shaped gland is our body's natural thermostat, regulating everything from body temperature to metabolism. Its hormones are vital for our body's various functions, including our heart rate, digestion, and even our mood. We also explored common thyroid disorders, from hypothyroidism, where the thyroid underperforms, to hyperthyroidism, when it's overactive. These disorders can significantly impact one's quality of life, causing symptoms like fatigue, weight changes, and depression. But the good news is, they're typically manageable with the right treatment, which may include medication, diet modifications, or in some cases, surgery. As we conclude, remember that your thyroid, though small, is mighty and deserves your attention and care. Regular checkups and a healthy lifestyle are key to keeping this important gland in tip-top shape, because when it comes to your health, every little part counts.